At Sierra, discover joyous deals on great gifts for everyone on your list, like cozy slippers, ski gear, fishing poles, bikes, large kayaks, even larger canoes. Whew, which might lead to another discovery. Wrapping gifts is the only sport you need to stay fit this season. 'Tis the season to discover great gifts at unexpectedly low prices. Sierra, let's get moving.
Coca-Cola. For the big, for the small, the short, and the tall. Peacemakers, risk-takers. For the optimists, pessimists. For long-distance love. For introverts and extroverts. The thinkers and the doers. For old friends and new. Coca-Cola. For everyone. Pick up some Coca-Cola at a store near you.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and at the bedside. Today, we'll be diving into a pharmacology topic. Before we do that, let's take a quick minute for a listener shout out. This shout out goes out to Joseph, who has my program, MedSurg Solution, and says this: I really appreciate the effort that has gone into creating the study guides and videos to help consolidate key concepts commonly encountered in nursing. What I particularly like is how the content is broken down into simplified, bite-sized pieces that are easy to digest and not overwhelming. Thank you so much, Joseph, for sharing your experience with MedSurg Solution. And that really was my goal, to create something that would take a lot of that overwhelm away, because there's a ton of that in nursing school. So I want to wish you all the best, and thanks for being a listener to the podcast and in my MedSurg Solution program. Alrighty, so today we're diving into pharmacology, like I mentioned, and we're going to be talking about NSAIDs, and specifically the 4 big risks with NSAIDs, but we will do a little bit of an overview about what they are and how they work. So NSAIDs, also known as non-steroidal anti-inflammatory drugs, are very, very widely used medications, both in prescription form and over-the-counter form. So we're going to talk about how they work, what conditions they're used to treat, and again, those 4 big risks. So what are NSAIDs and how do they work? So just to keep this super simple, we're not going to make it complicated, because I'll be honest with you, when I first learned about NSAIDs in nursing school in my pharmacology class, it whizzed way over my head. And I thought, okay, I'm just going to try to get the basics, and all that complicated stuff about COX enzymes, I'm just going to ignore for now, because I have no room in my brain. So I hope this simplifies it for you. So the class of drugs known as NSAIDs work similarly, and that's why they're all in the same drug class. They work similarly to reduce inflammation, to reduce fever, and reduce pain by inhibiting cyclooxygenase enzymes, also known as COX enzymes. COX enzymes in the body have a very important role because they produce prostaglandins. So when we inhibit COX enzymes, we decrease prostaglandin synthesis, and that is key to understand how and why they work and why some of these side effects exist. So there are 2 types of COX enzymes, COX-1 and COX-2. Note that the prostaglandins associated with COX-1 enzymes play a very important role in protecting the gastric epithelium and maintaining both kidney function and platelet aggregation. This will come into play later when we discuss the biggest risks when taking NSAIDs. Now, most drugs in this class, in the NSAIDs class, are non-selective and inhibit both COX-1 and COX-2. However, there are a few NSAIDs, and only one in the United States, that are selective for COX-2 only, which means those medications have different side effects than those that also inhibit COX-1. And we'll talk a little bit more about this as we go. So you might be wondering, well, what drugs are NSAIDs? So there are quite a few medications within this drug class, and that's because there are several subtypes of NSAIDs, and this is based on their chemical structure and their COX selectivity. I'm not going to get into the chemical structure. Don't worry. I would not do that to you. You know that. I wouldn't do that to you. But let's talk about some of the most common that you will see. So aspirin is a big one, commonly used to treat fever, to treat pain, and to reduce risk for cardiovascular events and stroke. You will even see aspirin used in patients with acute ischemic stroke and in patients who are having a myocardial infarction. So when you think of aspirin, for the most part, your patients are taking it because they likely are taking it to reduce their cardiovascular risk or possibly even their stroke risk as well. And then there's indomethacin. Now, one very specialized use of indomethacin is as a tocolytic to stop preterm labor. It's also used to treat patent ductus arteriosus, or PDA, in preterm infants. Then we have the old standbys, ibuprofen and naproxen. These are very, very common medications that are used to treat pain and inflammation. And then we have meloxicam. This is a prescription-only NSAID used to treat symptoms of arthritis. Ketorolac is another prescription-only NSAID. We use this to treat moderate to severe acute pain and is commonly used in the post-op period. We're not going to be using ketorolac for a long period of time. Then we have diclofenac. This is available in oral and topical formulations, and diclofenac is used primarily to treat inflammatory conditions such as arthritis. Now, that oral form is prescription only, and it does have some, what I've read, some significant cardiovascular risks. So you're most likely to see diclofenac in that topical formulation, that gel that you can smear on your knee when your knee hurts from your arthritis or what have you. And then celecoxib is another NSAID, but this one is different. It is a selective COX-2 inhibitor. And you'll see this used a lot in the treatment of arthritis, and it is safer to use in those patients who have a history of GI bleeding, because remember, the prostaglandins associated with COX-1 inhibition decrease that protection of the gastric lining. So if we avoid the COX-1 inhibition and we selectively inhibit COX-2, then we're going to be safer to use in a patient who does have that history of GI bleeding and peptic ulcers. Celecoxib is the only COX-2 selective inhibitor that is available in the United States. There are a couple others that are available in other places around the globe.
Doug.
Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Now let's dive into that quadruple threat, or those 4 big risks with NSAIDs. Even though, again, I cannot stress this enough, even though they are very commonly used, I do not want you to underestimate the potential and potentially significant risks. Use of NSAIDs can cause gastrointestinal problems, renal problems, cardiovascular problems, and hematologic problems. So let's dive into those. Looking first at the gastrointestinal risks. Now, because most NSAIDs are inhibiting COX-1, they reduce those prostaglandins that protect the stomach lining. So this makes patients more vulnerable to developing peptic ulcers and GI bleeds. This explains why a patient with a history of peptic ulcers or GI bleed would likely be prescribed celecoxib, which is that selective COX-2 inhibitor, instead of a medication like ibuprofen or meloxicam. Note that bleeding from peptic ulcers can be significant. And when I say significant, I mean significant. They can even lead to death. I've seen it many times. To learn more about GI bleeds, I do have an episode on that. And that is episode 107. So if you're interested in diving into that topic a bit more, I want you to go and check that one out. It's a really good one. So that was the GI risks. Then we have renal risks. Since prostaglandins also play a very important role in kidney function, NSAIDs should be avoided in those with renal insufficiency and probably used very cautiously or even avoided in patients who are taking a diuretic. And that's because diuretics like, say, furosemide can really do a number on the kidneys. You wouldn't want to punch the kidneys when they're already down, right? So we would avoid or use very cautiously in a patient taking a diuretic. Consequences of renal damage associated with NSAID use include hypertension, fluid imbalances, electrolyte imbalances, acute renal failure or renal dysfunction, and even things like nephrotic syndrome. Then we have the cardiovascular risk. Excluding aspirin, which can be cardioprotective, that's why you see so many people taking that little baby aspirin dose every day, NSAIDs can increase the risk of cardiovascular things like hypertension, myocardial infarction, atrial fibrillation, and even thrombotic events such as stroke or deep vein thrombosis. And then we have the hematologic risk. Due to their antiplatelet activity, NSAIDs are also associated with higher risk for bleeding. This is most pronounced in those with a history of gastric ulcers and patients with existing coagulopathies, such as hemophilia or thrombocytopenia, but can also come into play post-operatively or in cases of trauma. Let's say your patient hit their head really good, and they're taking a lot of NSAIDs. Maybe they've been taking NSAIDs chronically for a long time for their arthritis. I would be very, very concerned about a brain bleed in that patient and would be keeping a very close eye on their neurological status. Now, post-operatively, you will see NSAIDs used, and ketorolac is the most common that we're going to see used. Note that ketorolac is really only used for a very short period of time. Typically, we use it for less than 5 days because it does have, over time, high risk for bleeding. So now that you have reviewed those 4 big risks with NSAIDs, GI risks, renal risks, cardiovascular, and hematologic, you probably are thinking, I want to make sure we're using NSAIDs safely. So here's a few things that you can do. So 1, you want to ensure that the patient is instructed to use the lowest effective dose for the shortest duration, not to be taking tons of ibuprofen forever and ever if they don't need it. We also could advocate for concurrent PPI use. This will help protect the gastric mucosa. There is even a combination medication called Vimovo. I hope I'm saying that right. I do get a lot of comments about my pronunciation of things. Vimovo, I promise I'm doing my best. And Vimovo includes naproxen and esomeprazole, which is a PPI, and it's created for that very reason, to get that gastric protection along with the NSAID, the anti-inflammatory properties of the NSAID. And then we could also work with the patient to consider alternatives such as acetaminophen, provided they have normal liver function, of course. Topical NSAIDs, like that one I mentioned, diclofenac, which can be in a gel formation. You rub that on the knee, your knee feels better, voila, it's magic. And non-pharmacologic pain interventions. So there you have it, your quick guide to those 4 big risks with NSAIDs. And if you are interested in exploring more pharmacology, then I would love for you to check out Fast Pharmacology. This is my audio-based program, but don't worry, it does have printable study guides. And in this program, I teach pharmacology concepts in 5 minutes or less. And I'm pretty sure I've got a lesson in there that is 5 minutes or less on NSAIDs, along with a whole bunch of other medications. So I hope to see you in Fast Pharmacology, and I'll definitely be talking with you here on the podcast very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Experience the sequel everyone's been waiting for. Follow Drayton and Dallas as they navigate the challenges of college life while trying to stay true to both themselves and each other. Sideline 2 Intercepted, starring Noah Beck and Sienna Agudong, is streaming now for free, only on Tubi.